In the past 2 years, the whole world was gripped by COVID-19. Staying healthy became synonymous with societal lockdowns, wearing face masks, and mass testing and mass vaccination. Although soon it became clear that a lack of vitamin D dramatically increased your chances of being hospitalized with COVID, governments never advised to go out into the sun or supplement vitamin D. People with obesity and metabolic syndrome were also far more susceptible to get seriously ill from this coronavirus. But cutting down on starches from bread products could save you up to 1 kilogram of sugar per week, was never advised. During lockdowns, we were able to go to the liquor store, but getting a relaxing massage was considered dangerous. So now this crisis is over, at least temporarily. And it's very important that we start thinking about prevention and improve the general health of the population. This is the main focus of the Ancestral Health, understanding health and disease from the evolutionary perspective. The idea is simple. Let's learn from the millions of years we've evolved from a hunter-gatherer into the modern agriculture, and the 100 years of our food and lifestyle has changed even more dramatically. So agriculture gave us welfare, but not well-being. This is a general conclusion if you study these transitions. So why are we unable to tackle these diseases? I often have to think about the story of Ignaz Semmelweis, an Hungarian doctor who thought that washing your hands when you have just been dissecting a corpse before putting your hands on a woman giving birth would be a sensible thing to do. Because he observed that there were much more women dying of fever when doctors assisted with birth than they were assisted by midwives. So Semmelweis tried to convince his colleagues, but he was ridiculed, suffered a nervous breakdown, and died of a wound he suffered when he was beaten by the guards in the asylum. So this was, of course, 1865. A physician was trying to convince his colleagues that simple interventions could help to prevent disease. But he was not taken seriously, resulting in the deaths of a lot of unnecessary women and children. So now it's 2022, and we have a group of people here, both among the speakers and in the room, that are trying to do the same, but this time not for acute problems, but for chronic disease. These are simple interventions, and they can save a lot of people, and you can regain a lot of health with it. So one of these simple interventions is the ketogenic diet, the diet rich in fats and very low in carbs. And several among the speakers, just like Semmelweis, have been ridiculed for promoting these ideas. Eating fat, especially the saturated fats, will kill you. This has been the common wisdom since the 60s. But thousands of people who tried keto and dozens of scientific experiments have shown not only that keto is safe, but that it greatly improves the health of those who dare. Often against the advice of the doctors who try it. For me personally, I'm an osteopath. And it were osteopaths who, among others, studied the ketogenic diet 100 years ago already in relationship to epilepsy. If the disease requires neuroinflammation to emerge, the ketogenic diet, low carb, the ancestral diet, will be the first intervention to reverse this mechanism. I've seen many patients with migraine improving dramatically on ketogenic diets. And all these personal stories will eventually do the job. But it is frustrating to see the lack of support from the government and the medical establishment. So, at least for today, I hope everybody in this room feels really connected and supported. Nobody is alone out there. And let's give much needed support for the speakers who stick their necks out and make sure that they don't end up in the asylum.